iMatter asks what you want for you.
iMatter has been a positive outcome for the staff on the ward.
Here at the Golden Jubilee, we were able to enable the staff to understand the value of engaging with this service.
The ward I work on is an elective orthopaedic ward. It's made up of the charge nurses, ward nurses and the senior nursing assistants and nursing assistants. We do hip and knee replacements mostly here. In the team there is about 40 people altogether. When I started, I was lucky enough to be involved with SeaBass, which is not a fish. It stands for Caring Behaviours Assurance System. The whole experience of that is making sure our patients are getting what we want to give them.
We have regular monthly meetings to look at the care of the patients and how we can improve them.
The difference between SeaBass and iMatter is the SeaBass is more, it asks you what you want for your patient, whereas iMatter asks what you want for you. You know, we need staff experience to be better for our patients' experience to be better. It's saying, you know, we want you to be looked after, and if you're looked after well, you're able to look after your patients well, and our values is very much, you know, we want the best effective care for our patients every single day.
It's all about understanding how people feel, how they feel they are working within their teams. There aren't very many opportunities for staff who are much more junior in the organisation to feel that somebody's listened to what they say. It's the staff that actually undertake the process, and if you don't engage with them, then you don't know whether your process is working.
The findings that have emerged from iMatter was that nurses and the nursing assistants wanted to engage more with senior members of staff and collaborate much more with them so that our priorities meet in the middle, and so that we're all working together for the benefit of the patients. The changes that have been made since we engaged with iMatter the first time was that we've got team meetings every single week. Every Monday we've got team meetings. The other thing that came out of it, which has been really, really good, is the senior members of staff wanted to create a new integrated care pathway, which is the documentation we use on the ward. And instead of, you know, upstairs just making this document and giving it to us to use, they actually came to us and says, we want you to make this document, and then we'll check it over, and then we'll come back to you, make sure you're happy with it, and then we'll pilot it.
iMatter has improved the communication between the frontline staff and the hospital-wide hierarchy. The executives in the hospital started coming around the wards and doing walk rounds, and staff were actually aware of who was who in the organisation.
We've tried to focus what we're doing to ensure that we do make ourselves more visible. And I personally spend time in uniform working with the staff. I accompany a staff in what they're doing, and my personal feedback from that is that that's quite a positive thing. And people say, oh golly gosh, you look at you, you're dressed up as a real nurse. But that's the impression that the nurses have, is that people were too distant.
iMatter has been really good for staff motivation and morale because they feel more involved. They know that their staff experience and their daily working lives are wanting to be looked after now, and they feel like they've got their permission to speak up and say, we need to change this and we want to change it because we want to look after our patients better.
iMatter has given myself the opportunity to have time with my team to discuss all sorts of issues that possibly we never ever took time out to discuss, and actually get feedback from the team about how they feel.
Essentially there are two next steps. One is to learn the lessons about the implementation of the programme itself, so that it becomes better embedded and answers our needs better. And the second is to take the information that we're learning from the iMatter programme and use that to improve the functioning of our teams, our leadership structures, and become a higher, better functioning organisation.
As of next week, there's a paper going to our senior management team. It's effectively our action plan for this year around staff governance as a whole, which will incorporate our 2020 delivery plan. It incorporates the actions coming out of the staff survey and actually the themes that are coming out of iMatter. So over the next year, we'll be working through that, and hopefully, because it's all sort of saying the same thing, hopefully we should be able to address any of the issues that actually came out of iMatter, and the staff should actually start to see the benefit of it. And that's not taking away from the action plans that are being delivered at a local level by the teams. It's really important that we ensure that the managers are following through with that and delivering against it.